In the last two videos, we talked about foods, spices, and Ayurvedic herbs, and then yoga and pranayam practices that may help protect your arteries. But today, let's talk about the most prescribed plaque medicine in the world, the statins. Are they overused? Occasionally. Are they misunderstood? Very often. And can Ayurveda replace them? Today, we will break down the real science. Hello all, Dr. Neha Garg here. Welcome back to Healthy Buddha, where Ayurveda meets modern medicine. What do statins actually do? Statins work by blocking an enzyme called HMG-CoA reductase, which your body uses to make cholesterol. When this pathway is blocked, the liver produces less cholesterol. It pulls out more LDL out of the bloodstream. ApoB particles that carry the cholesterol go down. And most importantly, inflammation inside the arterial plaques that reduces. And this is the key, because heart attacks do not happen from the biggest plaque. They happen when inflamed plaque ruptures, and this is what statins prevent. What does the evidence say? Let's look at some of the big trials. The Heart Protection Study with over 20,000 patients showed that statins reduce heart attacks, strokes, and major cardiovascular events by 25 to 30%. Then comes the Asteroid trial, where high-dose rosuvastatin lowered LDL to around 60 and actually showed regression of coronary plaque on imaging. The Saturn trial confirmed this again. Intensive statin therapy doesn't just stabilize the plaque, it can actually shrink it over time. And yes, in the right patients, statins are not just preventative, they are disease modifying. What should you know about the side effects? The most common issue is muscle aches. This may be slightly overrated, as the real risk of developing muscle symptoms is only about 5 to 10%. And typically in older people, Asian ethnicity, and in those with hypothyroidism or vitamin D deficiency. Some patients may see mild elevation in liver enzymes or a slight increase in their blood sugars, but this is rare. So the takeaway is not fear, it's personalization and appropriate selection. For any condition which causes arterial plaques with inflammation, statins are absolutely essential and can be life-saving. These conditions include a history of heart attacks, strokes, stents, and very high LDL, poorly controlled diabetes, or kidney disease where chronic inflammation is tuned up. Now let's talk Ayurveda with the honest comparison. This is where things get interesting. Ayurvedic herbs like gugulu, arjuna, and berberine are widely used for lipid balance and cardiovascular health. But the level of evidence is very different. So let's break it down. Berberine has become a favorite with integrative medicine physicians. Multiple small studies and meta-analysis show that berberine can reduce LDL triglycerides and improve insulin resistance. It may work by increasing LDL receptor activity, somewhat similar though weaker than statins. Please check out our previous video on berberine for more details. Next comes gugulu, which has been traditionally used for metabolic issues due to medha dhatu or fatty tissue. But modern human data is mixed. A JAMA randomized trial found that gugulu did not improve cholesterol. So while it has strong traditional backing, the human clinical data is inconsistent. And the third is Arjuna, which is one of Ayurveda's best-known cardiac tonics. It shows antioxidant, anti-inflammatory, and mild lipid-lowering effects. Small human studies suggest benefits in angina and blood pressure. But when it comes to plaque regression, most of the evidence is from animal or mechanistic studies and not large human trials. So here's the honest truth. Ayurvedic herbs and nutraceuticals are excellent for improving metabolism, reducing chronic inflammation, supporting gut and liver function, and long-term cardiovascular prevention. But when it comes to high-risk plaque, prior heart attacks, strokes, very high LDL, or stents, The level of evidence for statins is far stronger than any herb available today. For actual plaque reversal, yoga, pranayama, and cardiovascular exercise remain the best long-term modality. So don't forget to check out the previous video on these. This brings us to our final takeaway. This is not a battle of modern science versus Ayurveda. This is about using the right tool for the right patient. Statins help reduce the fire inside the unstable plaques. Ayurveda helps improve the terrain, digestion, metabolism, chronic inflammation, and your daily habits. And the best outcomes often come when we combine both of these wisely. Because plaque reversal is not just one pill or one herb, it's a lifestyle system. Till next time, stay healthy, stay informed, and take charge of your heart health the healthy Buddha way.